All right. Good morning, everybody. Dr. Rafage here, Vet Triage, August 2nd, 7:47 a.m. Pacific time. Let's talk about veterinary careers. One of the cool things about veterinary medicine is that you have many options for career paths in it, and you also um, have no idea like what path you'll end up going down. And there are many veterinarians who wear multiple hats in the field. So we'll go over kind of like a brief, list of just random career options that you have as a vet, um, and maybe it'll give some of you new grads or vet students some ideas on how to make the most out of your degree. So we'll see. But keep in mind the just like anything else, as you go through life, you never know where you're going to end up. And so keep an open mind when you're looking at the direction of your career because, you never know. Never know. So it's exciting and, of course, frightening. So everybody thinks of veterinarians as being doctors who are practicing in a clinic. And even in that regard, you have plenty of options. You can work in a general practice where they are focused mostly on prophylactic care, so things like vaccinations and deworming and heartworm prevention, flea and tick prevention, preventing obesity, all that kind of stuff, and then of course taking care of pets when they're ill or traumatized. And the level of care that a general practitioner can give to their patients and their clients just varies on what the facility has to offer and what the veterinarian's comfort level is, et cetera. But in general, that's what they're looking to do. There are certainly general practices that do some pretty fancy surgeries that'll dabble in chemotherapy. There's a wide range of abilities, but general practice is what most people think when they think of veterinarian. Second possibility is being a specialist. So just like in human medicine, we have specialists: surgery, dermatology, cardiology, ophthalmology, radiology, pathology, many, many, many. And the difference between us and the human side, there's many differences in terms of specialization, but one that's especially important for this discussion is like what was coined a few years ago, super specialization, where you would be a veterinarian who's also a board certified surgeon, but instead of doing all the surgeries, you specialize purely in, let's say, orthopedics, or even more narrowly, you specialize in orthopedics, but only anything affecting the knees or the elbows or something like that. And that never caught on. It comes in waves, and then it just goes because there's not enough of a market for in veterinary medicine for just specializing in one thing. Whereas in human medicine, you can be hand surgeon and that's all you do, or hand surgeries or whatever. And so that's a very different ballgame there. But anyway, so you can specialize, and if you specialize, you're focusing on one part of the profession. You have to go through additional training, additional certification, and then you typically work either in a specialty hospital, so a facility that's has other specialists in there, or you're working as a traveling doctor. Radiologists can do that, for example. Internal medicine doctors can do that. Surgeons can do it. Um, or you can open up your own practice and be a sole specialty. And a lot of ophthalmologists and dermatologists will do that. Cardiologists will do that. So then the next possible career with it is emergency, and you can be a board certified emergency doctor, criticalist, which requires additional training and certification, or you can just go into the profession, into the ER, and work as an ER doctor, ER being emergency. And some emergency hospitals are 24/7, some are overnights and weekends, some vary, just depends. So that's another option. Another option you have after that is urgent care. You can work in urgent care, and that is supposed to be focused on cases that are not the happy, healthy, go lucky patients you'd see in general practice necessarily, nor would it be emergencies that are life threatening. It'd be the ones in between, they're urgent. And so it'd be ideal to see them sooner rather than later, but they don't need the intensity of an emergency hospital. And so you can be an urgent care doctor as well. and operate in that regard. It's a fairly new field in our in the vet space, but anyway, that's also an option as well. Um, and then there's pop-up clinics, so like spay neuter clinics, vaccine clinics. These are ones where they show up temporarily in an area, usually for like a day, maybe a couple days if it's surgery, and then they leave town, and they focus on helping the community that struggle financially, don't have access to care for various reasons other than financial, of course, and they get pets spayed, neutered, vaccinated, and all that stuff. Um, all this depends on what you want to do as far as what your interest lies, or what your goals are. Now, there are other options for the veterinarian. Oh, and also I forgot about shelter medicine. So you can work in the shelter and rescue world as well. Take care of pets that are relinquished, that are put up for adoption, don't have homes otherwise, need homes or whatever it is, and then you can um, work with those animals as well. And some are purely rescue, some are actually have clients that see them plus take care of rescue animals. It just depends. Some have foster programs, some don't. So those are all different types of practice. Let's move on to some that are maybe less thought about. Academia. So you could be a veterinarian and work in a university or some sort of educational role. Maybe you're not in a university giving talks and teaching students, doing research. Maybe you travel the country or the world giving talks at conferences and expos things. And so you can do that as well. If and as an academia, you can be, again, any of the other things that I mentioned before. You can be a specialist or a GP or emergency doctor. All of it's up for grabs. It just depends on what the community wants and where your interest lies. But you can go to academia and work in a university. You can travel around and give talks at conferences and things like that. You can also work for wildlife. You can work for marine animals. Any animal you can think of. They typically are low-paying positions that are very, very difficult to get because the folks who want them are a small group, but there's not a lot of positions for that, and it's a very unique career choice. So whether you're going to work in a large aquarium, or you're in a helicopter tranquilizing rhinos and stuff in Africa, or there's so many crazy things you can do with that. But anyway, so wildlife, marine stuff, things like that, aquariums, etc. It's another option. Research is another option. So you can work in a laboratory behind the scenes, and working on cancer treatments or the newest medication to solve whatever problem. You can also be involved with clinical research, where it's not in the laboratory, it's not the microscopic or pharmaceutical. It's more of real animals that are getting XYZ treatments, and you're seeing what the outcomes are. And that can be in the context of academia, it can be in the context of your own hospital, but you can be a research clinician as well. So that's another option for you. Um, you can be a sales representative, so you can join a company that you are fond of, whether it be in the nutrition industry or pharmaceutical industry or a device company, and you can be like a representative for them on the veterinary side of things, and that usually involves giving talks and getting input on their newest products or what direction the company takes, all that stuff. So that's also another exciting option for you as well. Um, yeah, I think that's probably a pretty good overview. I'm sure there are many more. There are veterinarians who invented surgical tools, who invented devices. I created vet triage, and so it was the first of its kind. Telehealth, all that stuff. So you can be as entrepreneurial and as innovative as you want to be. It just depends on what your interests are. The but when you go into vet school, and you're trying to figure out what you want to do, don't think that might be the last thing that you decide. You can expand to other things or change courses or whatever else. And we even talk about the different species other than like wildlife and marine and that stuff. Um, you legally you're allowed to practice on any animal that's not a human that you want, and in some regard you can't practice on primates in general, but otherwise you're welcome to work on any and all animals. It just depends again on what your interest is and what additional training you want to go through for that. Oh, one more I forgot to mention is euthanasias. It's a big one now where the doctors are set their own company and they'll drive to homes to put pets to sleep. That's a service that's been very popular on the veterinary side of things. Obviously, there's a need for that. And then finally, actually, I forgot to mention also relief veterinarians, which overlaps with the other positions I mentioned. But a relief veterinarian is one that goes into a hospital and is basically like a substitute teacher. They go in, they practice for the day, they leave, and they're not a permanent fixture at that facility. And that could be in the general practice level, it could be at the specialty level, emergency level. So, okay, that's good enough for there. I'm sure there are some that I've missed. Thanks to those who watch on the playback, and thanks to those who donate and subscribe and like and all that stuff. I'll see you guys tomorrow, Saturday, August 3rd. Take care.